In science, we look at it from a perspective of the different types, and collagen is to the tissues in the human body what steel rods are to reinforce concrete. It's what keeps things very strong. And if the steel rod of the frame is weak, then the whole structure weakens. So it's the same way with the collagen of the human body. Any part of the human body that the collagen has structurally become weak, then that part of the human anatomy is very likely to be weak. And clinically speaking, there are more than 20 different kinds of collagen found in the tissues of the human body. But the 5 major ones that we're going to talk about tonight comprise 99% of all the collagen found in the human body. So we can leave off the other 15 and not miss anything. But really and truly, we have it all structured and working together. And depending on the different types of collagen that are in your human body, what makes type 1, type 2, type 3, type 4, type 5 is the variation of the sequences of the amino acids. There are 20 different amino acids in the human body, and DNA, that marvelous computer that speaks, that cell talks, talk, DNA lays down the peptides, the amino acids in certain strings, and depending on what's laying next to what, that's the type of collagen that we have. So let's look at the next slide and realize that tonight we're going to be talking about 99% of the human body. And type 1 collagen, the amino acids are all alike. They're all laying there in the same structure in the bone, the tendon, the ligament, and the skin. So pretty much so, type 1 would cover a very large part of the human anatomy. Type 2 cartilage and eyes. So type 2 collagen is what gives you the sponge between all the bones that keeps you flexible and keeps bone from rubbing on bone, type 2. Type 3 collagen is what makes up your liver and your lungs and your arteries. Type 4 collagen is the kidneys and all the little internal organs, the things that are trying to make these hormones and keep things going. And then type 5 collagen is the surface cells, the cell itself, and there are 70 trillion cells in the human body. They all have a membrane, they all have a surface to keep the enemy out and to let the good flow in and out. Even your hair is made of type 5 collagen, and in the womb of a mother, the placenta is made of type 5 collagen. So put all these types together. We're talking 5 types tonight, and they all have one thing in common. They are conjunctive tissue. They are connected. They keep things from falling apart. They keep us from puddling or pooling. And when you look at it, the collagen could be called a type of human glue. And it has this stickiness, but it also has this flexibility. It's better than a 3M glue. I've seen 3M now where they can take glue and stick things to a plaster wall, and it'll stay put, and then peel it right off without taking the plaster off of the wall. Better than that is what God has made inside the human body. So this glue, this elastin, is connected with glycoproteins. Glyco meaning sugar, protein meaning amino acids. Elastin plus glycoprotein. It forms this rebar, this structural integrity between every cell, 70 trillion cells, and they all have to be held together. Medically speaking, we call it laminin. Laminin is the official name. So these 5 types of collagen give cohesion to the tissue and cohesion to the organs. It helps the organs to hold together, but it's also permeable. so it helps the organs to be hydrated. Isn't that neat? All the fluids of the body can seep in, seep out, but not seep away. Wow, it's an amazing human body. Collagen type 1, 2, 3, and 4 gives the organs resistance, elasticity, flexibility. See, these things can't be stiff as a marble. They have to be flexible, and they have to be elastic, and they have to be resistant to the enemy, but proactive with the nutrients that are coming. And when you look at it under a microscope, you can see that it's all been woven. There are these horizontal threads rich in collagen in every part of the body. They're woven together. The fibrous structural protein are woven together. And the purpose of this rebar, the purpose of these steel rods, but yet flexible, are to serve as support and fillers and joints and even insulation and protection and even transportation in the case of the blood system. It's collagen in the blood that acts like a boat to get this property over here to that property. And while it's acting as a sort of glue that keeps us together, and it's utilizing hydration, all this stuff is alive. It's physiological. It's real. And because aging, the older we get, the more we lose. And because aging and lifestyle directly affect several of the metabolic processes that our body may lose its ability to synthesize new protein. See, collagen is simply protein. And if your body is not synthesizing and making new protein for whatever reason, accident, age, trauma, bad pH acid levels in the human body, then you're going to have to supplement. You're going to have to eat perfect foods, or you're going to have to take a perfect supplement. And because the human body is constantly under stress due to whatever injury or degenerative problems, these things in conjunction with aging, then it says to you and me that we need more than we've ever needed in our life, more amino acids than we normally do. So we need to take it in. We need to supplement it. You're not going to get it in a perfect food because you're not going to eat a perfect food. So we're going to have to give you a perfect vitamin that gives you the perfect collagen. Collagen starts decreasing at age 30 in all human beings at a rate of 1% collagen loss per every year. And by the time somebody reaches age 50, that's 2 decades, 20 years from age 30. By age 50, there is usually an abrupt decrease in collagen. So who are the candidates who must take collagen every day? Age 30, 31, 32 and up. Age 50 and beyond, maximize the dose. You're already desperate and don't know it. So without collagen, there's going to be a reduction in the functions of the human body. There's going to be a loss of resistance, elasticity, flexibility. Go try and work out in your backyard this weekend and be a weekend warrior. And see if the next morning your body doesn't get stiff and sore and tired and achy. That's collagen. That is absolute collagen and resistance. And you lose the flexibility and the elasticity. Look at your face in the mirror. Find wrinkles. Squeeze your skin. Lack of tonus. Muscle soreness is an indication of lack of collagen. Joint and muscular stiffness means that you don't have enough collagen. Slower healing of wounds is a collagen deficiency. more frequent fatigue, tired. See, the energy, the blood runs off of collagen. You can't carry the energy because you don't have the collagen to move it about. Frequent fatigue means collagen deficiency. So we look at these white fibers under a microscope, collagen fibers. They're called type 1 collagen, bone, tendon, ligament, skin. And if you look at it under a microscope, it's the connective tissue. It's the skin, the tendon, the bone. Some of the type 2 cartilage is white collagen fiber. It's made up of cartilage. You take cartilage and look at it under a microscope. It's white. Look at your eyeball. It's white. And when you look at these substances with high intensity electron microscopes, we realize that this is a gelatinous, a jelly-like, a gelatinous substance. And collagen has weaving into its horizontal threads, into its fibrous structural protein, it has gelatinous substances. And the reason the gelatin is in there is to keep this rebar, this steel rod, from stiffening, from getting too stiff. And one of the great, marvelous structures of the human body is called the eyeball. And inside the eyeball is this liquid substance that keeps the eyeball from flattening out and keeps the eyeball round. And this stuff is called vitreous humor. That's what the liquid of the eye is, the vitreous humor. Guess what it's made of? Nothing but gelatinous collagen. 25% of protein weight in the total body is collagen. 25%. 75% of your skin is collagen. So you look at it, the greater parts of the human body is made of collagen. And collagen not only holds us together, gives us integrity and flexibility and usability, collagen also serves as a main catalyst for growth. And collagen is necessary in the fact that it assists the human body in repair of almost every single tissue of the body. You cut, scrape, bruise, stab, puncture. Anytime you got a damage to the human vessel, collagen is what's going to put you back together. Now let me tell you how I got involved and know about type 1, type 2, type 3, type 4, type 5 collagen. I introduced collagen to the medical arena here in Georgia well over 20 years ago, And I actually was able to get and was part of the infrastructure, the working of the Harvard Medical School studies, and they were working on type 2 collagen. The only reason we had type 2 was because we were only using the anatomy of a chicken sternum bone. And a chicken sternum bone only has type 2 cartilage. It misses all the other types. But nonetheless, we were excited about it because type 2 cartilage is what cartilage is all about. And what we were looking at was we were trying to help people with arthritis. Now, in 1998, most arthritic patients were taking a lot of non-steroidal anti-inflammatory drugs. They're called NSAIDs. And boy, were they blossoming as the drug of choice in firing away the symptoms of arthritis. But the problem was NSAIDs like ibuprofen, Motrin, Advil, ketoprofen, things like that. The problem with these drugs, they were simply suppressing the arthritis syndrome, the symptoms itself. They were reducing pain and inflammation, but they were not curing it, not one iota helping it, not one iota helping it at all. The drugs, the non-steroidal anti-inflammatory drugs, were only masking the problems. You see, NSAIDs have been found to inhibit cartilage repair. So people that were taking ibuprofen or ketoprofen or Motrin or drugs for their aches and pains of their joints were literally physically tearing down, breaking up, and destroying their cartilage. It inhibits cartilage repair. It causes people to have knee replacements, hip replacements, shoulder blade repairs. It's the pills they're taking that's causing all the damage. And now the underlying inflammation continues to damage the joints further because we're only masking the symptoms. We're not curing it. We're not going at it. We were only knocking out the pain. They didn't know they still had the inflammation. And the non-steroidals, because they were blocking pain, they didn't know it, but they were actually having a likelihood from their drug to cause a stomach ulcer. Now, the drug itself wasn't going in there and grinding a hole in the stomach. Non-steroidal anti-inflammatory drugs reduce a hormone called prostaglandin. And whenever this lipid, this fat hormone, this prostaglandin is decreased, see, the prostaglandin, the lipid hormone, is in your stomach for a purpose, to protect the stomach lining. But non-steroidal anti-inflammatory drugs knock out prostaglandin. So this made the stomach more vulnerable to the stomach's hydrochloric acid and the stomach's pepsin, and now their normal gastric juices were eating away at their stomach wall. And people were getting stomach ulcers, peptic ulcers, duodenal ulcers, from taking their cotton picking pain pills. So nonetheless, I was very excited when I was in on the original research, and we were looking at ways to treat the root cause, not a symptom. See, what is arthritis? That's a good question. Well, arthritis is inflammation of the joint, cartilage, tendon, and ligament. Inflammation, hear me? And we need healthy cartilage to cushion the joint movement and to allow the bones to slide more easily, smoothly, and effortlessly. However, when the cartilage becomes thin or softens or cracks or corrodes, then the bone starts rubbing together, excruciating pain and stiffness. So in 1998, we began to introduce to the world market type 2 cartilage protection called collagen type 2. And lo and behold, I'm here to tell you, over the last 20 years, we've seen major improvement in people's knees and hips and backs and shoulders and elbows and fingers and wrists and thumbs and ankles and toes. Not because of a non-steroidal, and no, they're not taking any drugs. They're on collagen. And collagen not only supplies the amino acids to rebuild, but guess what? Some people have no idea. Collagen is rich in glucosamine sulfate. Did you hear that? This is not shellfish. This is bovine collagen, rich in glucosamine and rich in chondroitin. And when you put glucosamine and chondroitin in the human system, now these little building blocks we call them glycosaminoglycans and proteoglycans. We call them laminin. We call them protection. These are the building blocks of cartilage. So for the first time in the history of medicine, people, instead of tearing down, see, aspirin tears down your cartilage. Motrin tears down your cartilage. So for the first time in the history of medicine, orthopedic surgeons started seeing that, wow, these people are actually rebuilding cartilage. We never thought it could be done. No, they always thought it couldn't be done because the drugs they were giving them were knocking down their cartilage. Collagen, when it starts going into repair and into the rebuilding business, that means good things. And since cartilage has no blood supply, you see, the knee and the hip has no blood supply to the cartilage. This articular cartilage of the joints has no blood supply. It's a sponge. It depends on the fluid that it's in. So it's like a sponge in a mop bucket. You got to have water in your mop bucket for it to work. Please hydrate your body. Please drink water to make the sponge have more hydration. But I guarantee you that if you're going to use your sponge in your mop bucket and you're going to mop the floor, doesn't it work better with spick and span than it does with plain water? Yes. Well, that's what collagen is. It's like putting spick and span in your bucket, so now your sponge can do more work. And now the sponge of the cartilage begins to get nourishment from your Visi wellness, from your Visi collagen protein. You see what we're doing? We're giving you nourishment for the liquid surrounding. We're putting more spick and span in your mop bucket. Now, the universe creating God, we're talking about the universe creating God. He's also knitted our human bodies together with amazing detail and wonder. So, and you look at that collagen type 2, it's part of the eye structure. And guess what? There are people out there that suffer with glaucoma. That's intraocular pressure in the eye that goes beyond 21 millimeters of mercury. Well, what's the number one cause of general glaucoma pressure in the eyeball? A strong correlation between the composition of the collagen in their eye. Their collagen is not functioning properly. And without proper collagen, there's always going to be an improper strength and an integrity to the eye tissue. The connective tissue network of the eye is made of collagen, as well as the blood vessels going into and out of the eye. And I just mentioned 5 minutes ago, the aqueous humor is all collagen. And the aqueous humor, the liquid part of the eye, must pass through the connective tissue to reach the canal of spleen in order to go in and go out. And if it's not moving out the canal, pressure builds up. Build the collagen. Watch the eyeball get healthy. Watch the pressure go down. Poor collagen results in decreases in the aqueous outflow. Let me talk to, I'll talk to Gloria here for a moment on the collagen matrix in periodontal membrane. See, Gloria's daughter is a dentist. And guess what? The periodontal tissue of the mouth, it's a collagen matrix. And this stuff called collagen type 1, these things called type 4, type 5, type 1 and type 5 in particular, they form the periodontal membranes that serve to anchor the teeth to the bone, and that allows the dissipation of tremendous amounts of pressure that people exert on their teeth and bones when you chew. So the healthiness of this collagen matrix is going to majorly affect the ability to resist inflammation in the mouth, which is going to majorly control bacteria and the byproducts of bacteria and the destructive enzymes in the mouth. So how are we going to prevent periodontal disease and dental caries and broken bones in the jaws and the teeth? With collagen, because periodontal collagen is constantly being renewed. It is extremely vulnerable whenever there is a necessary missing link. You've got to have protein, collagen, but you also need zinc and copper and vitamin C and B6 and vitamin A to make the collagen work in the gum. So that's the reason for Visi Wellness. It makes collagen happen. And reinforcing the natural cross-linking collagen fibers to make them stronger is what collagen protein chews are all about. And whenever the flavonoids come in, the flavonoids are what we call Arctic cloudberry, lingonberry, that's a flavonoid. When these berries and plants are utilized simultaneously with the collagen, the recovery is cut in half. Now, you take a sports injury where they need to heal faster, you put them on wellness with the flavonoid enhancement and the collagen protein chew, and you'll cut their injury time in half. So sports injuries, tendonitis, bursitis, sprains, strains, bruises, the tissue that connects the muscle to the bone, that's called a tendon. The Achilles tendon, that's at the back of the ankle. This stuff is going to be marvelous for people with ankle problems. Bicep tendons, that's up here on the front of the shoulder. People are going to be able to row their boat and move in motion. The brevis and the longest tendon, that's your thumb. The brevis and the longest tendon. Your thumb's going to be more flexible, less chance of being achy. The upper patellar tendon, that's your knee. You're going to help it. The tibial tendon, that's the inside of your foot. The rotator cuff, that's your shoulder. The bursa is the little sac-like membranes that contain the fluids that lubricate all the joints, the shoulder, the elbow, the hip, the lower knee. All these things go together. And again, let me re-emphasize flavonoids. Visi Wellness strengthens the collagen structure to hold themselves together faster and better. And because our product is different from other people's, we have all 5 collagens in one simple chew. So we're going to look at you and take care of you from top to bottom and even the bottom of your feet. and Gloria, that is the rest of the collagen story.
Well, Dr. Rouse, you know, we have done a lot of calls together over the last 10 years, and I can't even begin to tell you how excited I am about this product. Of all the things we've worked with, I think we're going to make the most impact with people with this product, maybe beyond anything we've ever seen before. And I was just sitting here texting different people as I was listening to you tonight because I'm so excited about this product. And we are literally just 2 weeks away from the release of this in Las Vegas. So for those of you that are going to be with us in Las Vegas, you're going to get your hands on this product first. And I know there will be an announcement going out tomorrow about a special call on Saturday, so you want to stay tuned for that information. And again, Dr. Rouse, thank you so much for putting all this information together for us. It's so helpful, and it just helps us to know who we're going to be able to help and the people we need to introduce this product to, which is lots and lots of people. So thank you so much. Thank you, everyone, for joining us tonight. And again, thank you, Dr. Rouse, and we will talk to you on the next call. Good night, everyone, and have a great weekend. Have a great